students. My name is Aslanova Makhlyodjo Raboyevna, Department of Obstetrics and Gynecology, Bucharest State Medical Institute, name of Abu Ali ibn Sina. Today's topic name is adenomyosis. Contents adenomyosis is how we, with your introduction, definition, symptoms, causes, adenomyosis with endometriosis, 4 stages of adenomyosis, diagnosis, treatment, management, and adenomyosis in infertility, case history of adenomyosis, and questions. Introduction. Adenomyosis typically affect women in their reproductive years, particularly their late 13th to early 15th, and often associated with a history of childbirth or uterine surgeries like caesarean section, although the condition is not life-threatening. It can significantly impact a woman's quality of life. Diagnosis is often challenging, and to release on imaging techniques such as ultrasound and magnetic resonance tomography, and it is definitive confirmation usually made through histological examination after hysterectomy. Adenomyosis, how we know it's adenomyosis, it starts to grow into the muscle wall of your uterus. Its endometrium grows inside the muscle, and it causes your uterus to thicken and enlarge, sometimes up to double or triple its usual size. Adenomyosis can cause painful periods, heavy or prolonged menstrual bleeding with clotting, and abdominal pelvic pain. Do you know it's the difference between fibroids and adenomyosis? Symptoms of adenomyosis. Symptoms, it's first painful periods, it's like dysmenorrhea, heavy bleeding during your period, it's menorrhagia. Its other symptoms can happen anytime in your menstrual cycle, such as pelvic pain, it's pain in the lower part of your abdomen, also tummy, bloating, heaviness or fullness in your tummy, and pain. Some people with adenomyosis have no symptoms, it's maybe asymptomatic. Causes of adenomyosis and causes of more etiological, because doctors don't know what causes this condition, but they have some theories. First, it's invasive cells. Cells from your uterine lining may invade the muscle wall. If you have surgery on your uterus, it's such as a caesarean section, that might provide an opening for cells to spread. Developmental origins. Some cells might grow in the wrong place during fetal development, meaning you are born with misplaced tissue already in the muscle wall. It has also been linked to elevated aromatase levels, and enzyme responsible for synthesizing estrogen. Additionally, studies have indicated that age perigee may play a role. The risk of adenomyosis has been found to decrease after menopause, likely due to change in the levels of various hormones such as progesterone, estrogen, prolactin, and follicle stimulation hormones. It's our symptoms. And how we different it's adenomyosis or endometriosis. Adenomyosis and endometriosis, it's the same type of cells that line the uterus, also grows outside of it. If you is outside from uterus, it's endometriosis. And adenomyosis, it happens when the same kind of cells that line the uterus also grows deep in the muscular wall of the uterus and thickness it. Adenomyosis, it's only to uterus. Endometriosis, it's outcome of the uterus if you have some endometriosis. In adenomyosis, have four stages of adenomyosis. It's A, B, C, D. Stage first, it's early adenomyosis. The initial stage of adenomyosis is characterized by minimal infiltration of endometrial tissues into the uterine wall. Often symptoms at this stage are mild or non-exist, making early detection challenging. And the second stage is moderate adenomyosis. The infiltration becomes more pronounced. It's like affecting a larger portion of the uterine tissues. This stage is often marked by heavier periods and increased menstrual pain. Additional symptoms may include bloating and discomfort during intercourse. And stage third, it's severe adenomyosis. It's the third stage of adenomyosis, involves severe infiltration, loading to the distortion in the shape of the uterus. Symptoms can intensify at this stage, causing significant discomfort and potentially interfering with daily life. It's very painfully. Pain during menstruation may escalate, and 3 might be an increase in menstrual flow. And the fourth stage is advanced adenomyosis. It's severe adenomyosis, extensive tissues infiltration and potential damage to the uterus. Its symptoms are often severe and chronic, including persistent pelvic pain, heavy bleeding. It's 4 stages. And also classification: minimal, mild, moderate, and severe. Minimal, it's focal. Endometrial implants have not appeared or attached to any particular area. Period and digestion problems. And mild adenomyoma, it's endometrial implants get placed at deeper level on one side, or there may be multiple sites with implants. And diffuse, it's moderate adenomyosis, is endometrial tissue grow in size and spread throughout the uterine walls. Adenomyosis symptoms are visible. And severe advanced adenomyosis, it's deep, widespread implants, cysts and adhesions, severe pain, infertility, and chronic digestive issues. And how we diagnose it through ultrasound? We can see this table. Ultrasound change, it's how we different adenomyosis with focal adenomyosis, and to ultrasound definition of the lesion in diffuse adenomyosis, indistinct, and shape of indistinct, and contour indistinct, and shadowing as fan-shaped shadowing liner, hypoechoextration. It's diffuse presence of inflammatory diffuse areas of mixed echogenous, small cyst, echogenic islands, and echogenic subendometrial lines. And vasculatory with translation flow, diffuse minimal or few vessels. Endometrial rim is irregular and distorted. And to focal adenomyosis, its definition of the lesion usually well defined in cases of cystic hyperechogenic lesions. And symmetry uterine involves, it's often symmetric. But in diffuse adenomyosis, wall difference in forward and anterior pharos, posterior wall is asymmetric. But contour is irregular or indistinct, and shadowing, rarely fan-shaped shadowing or linear hypoechonicstration. And echogenicity, it's focal, mixed echogenicity, small and large echogenic islands, and echogenic subendometrial lines or buds. And vasculatory, diffuse minimal, sporadic, and vessels, often regular or imprinted by subendometrial focal lesion to endometrium rim. And other diagnoses have diagnosis of adenomyosis. It's like physical exam. In manual examination, we use the patient's symptoms and then palpate, feel the uterus. It may feel spongy or globular uterine enlargement, uterine tenderness, and with boggy consistencies if adenomyosis is present, says. And sagittal grayscale, it's transvaginal ultrasound image with two focal areas of shadowing seen early and rather than the typical fan-shaped shadowing seen in adenomyosis. The endometrium is distinct from the myometrium. It's, however, the junctional zone is difficult to identify. This imaging fundus may represent adenomyosis, although the lack of the shaped shadowing and the other diagnostic features makes the diagnosis less certain. And we also check Oncomacuris TI 125 blood test and indicates severe adenomyosis. And picture we can show it's to vaginal ultrasound and magnetic resonance tomography we can see. And diagnosis also